Hello everyone, and welcome to another AssureLearns webinar, where today our focus is all about respirator fit testing. So I put this webinar together. My intention with it is to answer a lot of the frequently asked questions that we get around what happens during a respirator fit test, how often do we need to complete this, what is the difference between quantitative and qualitative fit testing, what are the OHS requirements, the CSA requirements. So I put this together in talking to our staff and getting a lot of, hearing the questions that we're getting most from safety managers, company owners when it comes to respirator fit testing. Do we have to do this? When is it required? To educate you as well on what happens during a fit test, because if you're in management or maybe a company owner, you haven't actually had to do a test yourself. It's just your workers that have had to do it. So we'll talk a little bit about what's required or what we do during a fit test. So I am John Riccocci, founder and CEO of Assure Occupational Testing, where what we do at Assure is we help you ensure your workers are fit for duty and your workplaces are safe. And how we do that, and how we've been doing it for over the past 15 years, is through drug and alcohol testing, and writing policies and supporting companies with drug and alcohol policies, again, making sure it complies with Canadian model. And OHS. We do that through occupational health testing, which includes a lot of different types of testing. Respirator fit testing would fit under there, lung function testing, health assessment, physical abilities testing. And we also offer supervisor training. So reasonable cause training and helping companies create a program and a plan and equipping managers to handle, when a worker is presenting as not fit for duty, how to properly handle those situations. So again, where we're going to go today is cover the who, when, and why of respirator fit testing, talk about occupational health and safety and the Canadian Standards Association. And then I'm going to jump in and touch on some of the FAQs that we get here at Assure. And I'll leave time. If you've got questions as we go, feel free to put them in the chat. So first off, who needs to be fit tested? Any worker who is exposed to an airborne contaminant. So that's pretty wide open. I've got some examples following, but those examples are just a few. So essentially, it's any of your workers who are exposed to any airborne contaminant. Dust, here's the examples are dust, fumes, gases, any biological hazards. So some of the ones that a lot of us in this industry are most familiar with are asbestos, silica, and coal dust, because in OHS, in no matter what province you're in, typically these are spelled out: asbestos, silica, and coal dust. There's specific procedures and recommendations on how to assess and properly care for workers who are exposed to those. But the procedures that we use for dealing with asbestos, silica, and coal dust, I would recommend to be using those as well for workers who are exposed to a variety of other things. So, and if we could get more into that assessment, asbestos, silica, and coal dust, specifically that the requirements there to complete a pulmonary function test, to do respirator fit testing, a chest X-ray, and then a health assessment questionnaire that goes along with that. So that's a whole another service that we offer that goes along with that. But who needs to be fit tested? Anybody that's exposed to anything could be potentially floating in the air and harming them. So when should workers be fit tested? Prior to exposure. So when we talk about a fit test, this is where somebody is not just putting a mask on and saying, yeah, that feels good. Yep, I think this is a good size. A fit test is a specific procedure that's conducted by a trained professional who's got experience in assessing and completing respirator fit testing. So they need to complete a fit test prior to exposure. So before going and working in the paint booth, before welding, before whatever the event is, they need to complete a proper fit test. What the CSA says is at least once every 2 years, a fit test should be completed. Some companies will say we're doing it annually. So your company might have a different policy, but what the CSA says is every 2 years. Or here's some other caveats that are really important to remember, because these ones I think can get forgotten about. Or sooner if a worker experiences significant weight loss, Because if we're gaining and losing weight, of course, that can show up in our face, which can change the shape of our face. So you might be a size medium, but if you gain weight, you could be a size large. If you lose weight, you could go down a size. If you have significant dental work, that could be changing the shape of your face. If you get dentures, that can change the shape, or other facial changes that may affect the seal. That could be injury or accident to the face. And we're mainly thinking about, we're thinking about mask fit testing. We're most concerned with where is that mask actually touching the face. So if it's a half face respirator, we need to have a proper seal from the nose around the chin. If it's a full face, it needs to be the full face. Workers should also be fit tested when there is a change in respirator. So what I mean there is, if a worker was fit for a Scott AV 2000, and now they're going to a new location, and the masks on that site are the Scott AV 3000, that's a completely different mask. So even though it's Scott AV, if it's a 2000, that's different than a 3000. Then there's a 3000 SureSeal. So the SureSeal, Scott AV 3000 SureSeal, is different from the Scott AV 3000. So if a worker is using multiple masks, multiple brands and models of masks, they need to have a proper fit test for every one of those makes and models of masks. Just because you're a large in one full face doesn't mean you're a large in every brand of full face mask. It can be different. So if there's a change in respirator, when there is continued significant discomfort during use. So a worker might complete a fit test, and then they start using it. They're using it for a day or two and realizing this is not comfortable. This isn't working for me. They may need to find another respirator that is more comfortable and that does work for them. Or when there's difficulty in completing a seal check. So by a seal check, we're talking about positive and negative pressure checks. So there is an exhalation valve on a half face mask. It's right in the front, and using the center of the mask. And then there's the filters that would go on the side. So air is coming in through the filters, air is going out through the exhalation. So the positive would be covering the exhalation valve. Blowing out, the mask should bulge, it should puff out slightly. When you're doing the negative, you're going to cover the filters and you should inhale. The mask should suck to your face. So if you can't complete a successful seal check, they should be fitted again. So why should workers be fit tested? Workers should be fit tested to protect against hazards. So just like we talked about, to protect from dust, fumes, gases, biohazards, to reduce the risk of respiratory illnesses and long-term health issues. You want healthy workers. You want to keep them long-term. You don't want to be creating an environment, a workplace where their work is impacting their health in a negative manner. So of course, it's about protecting workers, decreasing sick days, decreasing downtime, decreasing WCB claims. Number two, to ensure a proper fit and seal, a respirator must form a tight seal to be effective. Even small leaks can allow harmful substances to enter. And one of the things that I really like about quantitative fit testing, so I would say 99% of the fit testing that we complete here at Assure is quantitative fit testing. That's where an employee, a worker is hooked up to a port account is typically the machine that we're using. Hooked up to a port account, there's a hose attached to it, and it produces a quantifiable number that to tell us as the fit testers, to tell the worker, and to show them that this is creating a good seal for them, or that it's not. Because sometimes a worker can put a mask on and say, yeah, this feels good, or this is what I've been wearing for the past 6 months, and now I'm coming in for a fit test. I've been wearing this. A medium, and then we show them, well, a medium, you can actually show them on the screen. A medium is not giving you, is not meeting the minimum fit factor according to CSA. It might feel comfortable, but there's a leak somewhere. We can actually show them on the screen, this isn't a good seal for you. That's one of the reasons why I like quantitative fit testing over qualitative. And we'll get into that in a minute, the difference between the two of those. So third reason why workers should be fit tested is to comply with regulations. In Canada, OHS laws require fit testing for workers who are using a tight-fitting respirator. So what qualifies as a tight fitting? Any of the half face, even the N95s, and a full face is a tight-fitting mask. Why should we be fit tested? It confirms proper respirator selection. So different respirators fit differently. So again, just because you're a large in an MSA doesn't mean you're a large in a North. They can vary. A fit test ensures a worker is using the correct model and size for their face shape. So not all of our faces are shaped the same. Some are wider, some are narrower, some are longer and shorter. So not every mask works for every face. This is why another one of the important reasons of fit testing, another one of the important reasons why sometimes some of you might have gotten a phone call from our office saying, we're unable to get a fit on the Scott AV2000. Does your company have a secondary mask, an alternate mask that we can fit this employee with? And your company should, my recommendation would be you have a secondary mask available. And if you don't, that's okay. We can fit you for one. We can find in our office, we've got loads of different brands and models and all the sizes possible for every one of those in our office. We can find one that fits, and then an employee, then you can go and purchase that one for that employee. Of course, you need to make sure it complies with and fits with the, if you've got supplied air apparatuses, of course, you've got to make sure that the brand will actually connect with what you've got. And lastly, why we should be fit testing workers is to improve workplace safety culture. Regular fit testing promotes a culture of safety and compliance and reinforces the importance of proper PPE use. So let's get into OHS. We'll talk about Saskatchewan and we'll talk about Alberta. So there's a lot more involved. What I put here on the screen is just what the important things that I pulled from the OHS regulations. But of course, there's more in the regulations and code about this. But here's some of the must-knows that I pulled. Saskatchewan OHS says a worker must make sure they're fitted to find out what the proper size is for their face. The device, it also says the device must make an effective seal to the facial skin of the worker. So as I was mentioning, if it's a half face, it must make an effective seal to exactly where everywhere that mask is touching the face. And this is where facial skin or facial hair becomes important. We'll talk about that in a second. Sask OHS also says fit testing must be completed by a competent person in an approved manner. So competent, meaning they've received some training, they've got some experience in conducting proper fit testing. An approved manner, the approved manner that we use here at Assure is the CSA standard. So that's where we complete the 7 specific exercises that the CSA talks about. Normal breathing, deep breathing, side to side, up and down, talking, bending over. So what Alberta OHS says is that employer must ensure respirators are correctly fit tested in accordance with the CSA standard selection, use, and care of respirators. So that CSA standard is available. It's free here in Canada. We can access it online. I think you just have to make an account with the CSA to be able to access all of those standards. And then you can download that document. So that document is, I think, 160-page document helping you as an employer determine what respirator should we be using for our welders, for our painters, for our people in the field, people in the shop. It gives you guidelines on how do you properly choose the mask. So Alberta OHS says employers must comply with the CSA standard. Saskatchewan does not. But my recommendation would be, like, to me, the CSA is the highest standard in Canada. So my recommendation is no matter what province that you're in, follow the CSA standard. And that's what we're doing here at Assure. So I recommend that you check out that document, the CSA standard selection, use, and care of respirators. Alberta OHS also says worker must be clean shaven, again, where equipment seals to the skin of the face. So let's talk about that. Facial hair, another common question. So here's some pictures. I like diagrams, and some of your workers might need some diagrams, because clean shaven is the simplest to understand. Clean shaven, the CSA will actually even spell it out and say clean shaven within the past 12 to 24 hours. And they do, they do have wording in there that says, roughly, if we say 12 hours, some people grow hair real fast and some don't grow it as fast. So they say that, but essentially clean shaven. A mustache, yes, is okay. If it's pointing up and going underneath where the mask touches, it's not okay. Stubble, again, another question that we can get, is stubble okay? And the answer is no. And my recommendation would be, as a company, your answer is no. You report to work clean shaven. If a worker needs to wear a respirator, you need to report to work clean shaven every day. If you are wearing a mask, or if there is potential for you to be needing to wear a mask, if there was a rescue operation needed, because some people will say, well, I don't wear it all the time. But is there potential that you might need to wear it in the field today if there was an H2S incident? So of course, beards aren't okay. So here is another diagram. And I think I just put this up here more so because there's some workers who will probably, who will like diagrams. Some of us are visual, some like to know what's acceptable, what's not. So on the top left there, it's clean shaven, and the outline around the face is showing, again, this is a half mask. But if it's full face, if a person, it's got hair on their sideburns, if they've got hair, if, some people's hairline comes lower on the forehead than others, it's also something that needs to be considered. So obviously not so important that we know all the names, the fun names on here about what some of these mustaches and facial hair are called. It's more just I put this on here, and if you want a copy of this, I can tell you where I found it. I didn't create this, I just found it, because again, I think this is, some of your workers might enjoy, might appreciate being able to see it. So now let's talk about the CSA, the Canadian Standards Association. So again, best practice in Canada for respirator fit testing comes from this, and this is what we're basing things on. So here's some highlights that I pulled from there. The respirator user screening assessment. So CSA says that prior to a respirator fit test, and prior to someone wearing a respirator in the field or at work, a respirator user screening assessment needs to be completed. So they do offer an example. I think it's a 2-page document in the CSA standard there that you can use and create one for your company. Or what most companies do is they say, sure, can you complete that for us when we send them in for a fit test? So every fit test that we complete in our office, we are having the employee complete this respirator user screening assessment. So what that's about is to make sure that workers are free from physiological and psychological conditions that could preclude them from being fit tested or using the respirator. So a couple of examples there are, we're physically looking, at the shape of the face. Is there injury? Is there scarring? Is there something that could cause us to not create a proper seal with that respirator? Psychological conditions could be claustrophobia. It could be fear of heights, different fears that can come into play. So we've got a full list. We get the employees to check off and complete. Say, do any of these apply? Some other examples of physiological ones could be respiratory issues, asthma, heart conditions, fainting, seizures. If they've got a history of that, that might not make them the best candidate for someone to wear a respirator. So CSA says that needs to be completed prior, and that if anything is flagged on that health professional referrals would be made. CSA also says that it's the employer's responsibility to select the respirator, to do the evaluation and say, in this workplace, for this position, for this job, for this task, here's the respirator that is required. Here's the best fit. And it's the employer's responsibility to provide training to workers on the use and proper care and how to wear the respirator. And of course, part of what we're doing during the respirator fit test in our office is some education on that. So getting into some of the FAQs. So what happens during a fit test? So to run through the procedures, someone comes into our office, the first thing they're going to do is complete that respirator user screening form. And if there's nothing flagged, then we would proceed with the fit test. First step would be to put the respirator on, adjust the straps. So our job as the fit testers is to then view that, look at the mask. Have they actually adjusted all 4 straps? Sometimes there's a 5th one in the top, making sure that they know this one's got 5 straps as opposed to 4. Is it properly fitted? If it's a half face, is it sitting in the right spot on the nose, not down here? It's sitting properly. It's not poking them in the eyeballs. And they've adjusted the straps properly, making sure their chin is, this is also part of the comfort assessment. So making sure that their chin is all the way into the spot where the chin goes. It's all the way up. It's sitting tight. It's sitting where it needs to be properly sitting. And then showing them, we've actually got a mirror on the wall where if things are not sitting properly, we can show them, and then we can show them how, what's improper, then we can show them how it should be properly be sitting. So a comfort assessment is, also involves doing some movements for a few seconds, asking them how does that feel, getting them to talk, doing a quicker assessment, and then doing the seal check, again, positive, negative pressure checks. Positive, exhaling, the mask should bulge. Negative, covering those filters on the sides, and the mask should suck to the face, making sure that we've got a proper seal. Once we've got that, then we start the test. And then they would walk through the 7 different exercises. So each of these exercises is 30 seconds apiece. Normal breathing, deep breathing, turn your head side to side, up and down for 30 seconds. Talk out loud. So during the talk out loud, we get them to read the Rainbow Passage. So the Rainbow Passage is a universally used, the CSA even spells out that their recommendation is getting people to recite the Rainbow Passage during the fit test. This is universal, again, best practice. It might seem a little odd to get, when the sunlight strikes rainbows in the air, it acts like a prism. A prism is a division of white light into many beautiful colors. I've heard it so many times I can recite it. It might seem like an odd thing to recite, but it was written by a speech pathologist to get you to move and stretch, to stretch your jaw, and to stress the test to see is the seal going to break. So it's not just a cheesy poem that we're asking people to read. There's actually reasons behind it. So talk out loud, and then bend over, and then normal breathing again. So that's what happens during the fit test. So now we'll talk about the difference between quantitative and qualitative testing. So like I mentioned, 99% of what we're completing is quantitative. So this is where a worker they put the mask on. We've got an adapter on the mask. So where they would typically attach the filter to, we've got a special adapter that we screw onto the mask first, and we put the filter on top of that. That adapter allows us to connect the hose from the mask to the port account, which is the fit testing device that we're using. Quantitative testing gives us an objective measurement. So as the word says, quantitative, you can quantify it. Minimum fit factor for an SCBA, as an example, is 1,000. So we know we need to get over the 1,000 threshold. Anywhere over is a pass, anywhere under is a fail. So it'll give us a number. It will say 2,457 is the fit factor, for example. So it's objective. It measures fit factor numerically. We use specialized equipment. Again, the one that we're most often using is the port account. It's a brand. It works for all types of respirators. the qualitative does not. SCBA can only be completed with quantitative fit testing. And again, quantitative provides a precise pass or fail result. So qualitative, on the other hand, is subjective. So we don't get a number. How it works is it relies on the worker's sense of taste or smell. So if you've ever done this, so examples at the bottom, the saccharin is sweet taste, bitter, bitter, or the irritant spoke, which causes involuntary coughing. So Bittrex, if you've ever tasted it, done a fit test this way, it's really bitter, and you can kind of taste on the back of your throat. It can cause an almost involuntary response in an individual. So again, it's pass fail based on their ability to detect a test. So you would do a test first, a sensitivity test first before they put the mask on. You would spray either the saccharin or the Bittrex and say ask the worker to describe what they're tasting, because some people can't actually taste the Bittrex. So that's why we need to do a sensitivity test before we do the actual test. Or irritant spoke, which is using causing a puff of smoke in the room. And again, if a worker inhales it, if they've got the mask on, it's an involuntary response, which is a cough. So I mentioned the fit factor. Shifting gears, what is a fit factor? I mentioned for SCBAs, the fit factor is 1,000. So reading what's on the screen, a numerical value that represents how well a respirator seals to a worker's face. It's measured during quantitative fit testing and indicates the level of protection provided by the respirator. So the higher the number, higher the fit factor, the better the seal, the better the fit is for that worker. The minimum, so CSA sets out the minimum requirements. So for half face, full, N95, SCBA, it spells out the minimum fit factor, so that we pre-program that into the port account, and it's testing it to that minimum fit factor. It's determined by comparing the concentration of airborne particles outside the respirator to the concentration inside. So I put this picture up here next to show you the port account is the blue machine you can see on the desk there, and then the hose. If you look closely at the hose, you'll see there's a blue and then there's a clear hose. So one of those hoses is looking at the air, is comparing the air inside the mask. And then one of the hoses is comparing the air outside, the ambient air. So in our office, the air quality can be, it's generally quite good. It's quite clean. So we have to turn on what's called the particle generator, which puts salt particles into the air to simulate dust, fumes, gases that could be experienced in the workplace. So we're putting salt particles in the air, and one of those hoses is taking that concentration, comparing it to what's inside and seeing, is any of this getting in to a level that's over that minimum fit factor. So that's practically what's happening during the fit test. So talking about those fit factors, again, CSA standards this is what we follow at Assure, is the CSA standards. SCBA, self-contained breathing apparatus, of course, is what that stands for. It's 1,000, a full face 500, half 100. So full face, just a word there. Full face could be full face respirator that, for example, might be used during painting. If you're spraying, don't want that in your eyes, but it's just got filters on it, that might be acceptable for that application. SCBAs typically tend to be used when there's immediate danger to life or health. So the minimum fit factor is 500, half face, and N95s is both 100. So half face would be a half mask with filters on it. The N95, again, typically they're the white ones that have that, there's no filter that's attached, just the whole thing. It's, white fabric, if you will, that's filtering. The whole thing is a filter. And yes, for N95s, we can actually hook that up to the port account as well. What we do is we put an attachment directly into that N95, hook the hose up to that. And we're also doing N95s on the port account. So what type of mask should we use? So this is a question that you get to sort out by you as a company, you as the in your safety department get to sort out using the CSA standard selection, use, and care of respirators. You know your industry and your workplace best. So this is what each company gets to complete prior. And then when you phone to book with us, you tell us, here's the brand and here's the model of mask that we want our workers to be fitted for. So I put this graphic up there to illustrate some of the different masks. So you're starting at the top left is what we would call a half face. So it's just covering nose and mouth. Full face is covering eyes, nose, mouth. And it can just be with filters. The N95 is the white one there to the right of that. Then there's the power air purifying respirators. So this is providing air continually, and actually a fit test does not need to be completed with this, and it can be used with facial hair. So those ones are a little different. Supplied air, so SCBA would be the next ones that are illustrated there. So actually being connected, whether that's to continuous or to a pack. Visuals are super helpful for if you are not familiar with all of them. So again, that's why I put that up there. So do we Assure offer on-site respirator fit testing? Absolutely. That's exactly what our mobile testing clinic is for. We've got the 2 rooms in it. The back half of it is the soundproof booth where we're testing up to 4 people at a time for hearing testing. The front half is the other image that I've got up there where we set up and conduct mask fit testing on site. Of course, we bring that right to you. So that concludes what I've got for us for respirator fit testing. If there's any further questions, here's how to reach out. Please feel free to give us a call if you've got any questions, if we can support you with your policy, whatever policy that might be. Don't be afraid. We are always happy to talk with you and support the work that you're doing. So thanks for being here today. And that concludes the webinar for today.